welcome to Szenan-Balance. I'm the acupuncturist Szenan-Balance from Szenan-Balance. This is Szenan-Balance Live. So every morning we do in New Zealand time, about between 7 and 8 o'clock, we're going to do a live video. And that's been going for months, right? Today topic we're going to cover what are the migraine symptoms, right? So we talked about what is migraine yesterday. Now today we're going to talk about what are the symptoms of migraine. And tomorrow we're going to talk about what causes migraine, right? So we break down the topic a little bit by a little bit and to talk through it every morning and here with you. So for you to understand what all the disease from the how it happened, and then what are the symptoms, and how it present, and what are the treatments, and what can you do at home, and in the end we're going to show you some acupressure point that you can do, to manage at home, so give you some advice over here. Now let's start. When you come, hi Karuna, how are you? So when you are on this live video, please give me a thumbs up and tag your friends, your family who are suffering from migraine. Now tag them in, and as well as share on your Facebook page. Good morning, yeah, early morning. I wake up at 5:45, something like that. Yeah, so every morning we're gonna do a live video in here. So unfortunately today's setup is not including YouTube, but I'll take down this video and put up to YouTube. Normally we have YouTube, Facebook, and Instagram. Yeah. Today we only cover Facebook because the other device that's not working today. Two of them not working today. I couldn't set it up, so a bit late for the live video today. So let's straight go into migraine symptoms. So what are the symptoms? So they actually have four different phases, four different stages of migraine symptoms. Okay, the first stage, it can happen 1 or 2 days before headache itself. Before you feel anything in your head. Okay, this is known as we call a prodrome stage or prodrome phase. What are the symptoms of the first stage, first phase? You may, or your patient may feel food craving. That's very common, right? Food craving, craving for certain things. Of course, in New Zealand, most people craving for chocolate, right? Depression, yeah, they get depression before they get actual headache, right? And low energy and fatigue is another one, and like frequent yawning, something like that, like want to go to sleep, fatigue, feeling want to go to sleep, yawning a lot, okay? Or some people hyperactivity, like they move a lot, like, or they get anxious, and they get quite irritability, right? And there's another common thing is they get neck stiffness in the neck, right? Stiffness in the neck. So, and this after this craving for depression, fatigue, yawning, irritability, and neck stiff that started with, and then it comes with what we call aura. In migraine with aura, the aura means that you get some symptoms that is not actually headache, but those symptoms it actually come with headache sometimes, or you can get beforehand of your headaches, the actual headache, actual migraine, right? What is the aura means? The aura stage is you may have problem with your vision, sensation, or movement, or even speech. So think about sensation, movement, speech, it's quite familiar, right? What does he with this describes with this, stroke? Yeah, it got some sensation like you gonna get a stroke. Those sensation is horrible. It definitely is horrible. Okay, for example of this all this version, sensation, movement, and speech problem, that including difficulty speaking clearly. Yeah, people speak, but you don't understand what they speak. They it just doesn't make sense, but it happens suddenly. And if you find people keep saying that, excuse me, I don't understand you, and excuse me, and again ask you to, can you say it again? Can you say it again? Then you need to have a thinking. If you have migraine, you need to think about, okay, they are not, understanding me. Yeah, that might be the phase that you actually progressing to your migraine. Right? And you may, or your patient may feel tingling sensation on the face, or prickling, on the face, or even on the arm. Those, yeah, this is the sign that it may happen in what stroke, right? Tingling in the arms, on the face, or even on the legs. And they feel something, they not speak very clearly, and what else they do? They see something, they see shapes, different shapes. Then they see the light flashing, and they see some bright spot, and at worst they may temporarily lose the vision, like they can't see anything. It's all black in front of them. They can't see anything. So that is scary. Think about it. One of the reasons that people suffer from migraine, they get anxious, is because they worry. What if my migraine happen while I drive? And that I have a lot of patients that complain, worry about that. I just worry that when I drive, it suddenly happen. Or if your foot on the floor, more comfortable, but you on driving, if you're on highway and drive speed up, or you from this quite far away from your house, you're going home, and by your own, and it start to get those things, and you really worry about it, so that you get anxious, with anxiety. Migraine can cause anxiety too. Yeah. Now, in the migraine with this are all the oral things, right? We talk about oral, the symptom of oral. That we have Dr. Robert Chu, thank you for joining us, and Ming Lin, thank you for joining us. And what is the next phase after oral, right? Pre-drawn, symptom, oral, and now the next phase is the attack phase. I mean the real headache and the pain on your head is on the third stage. Hi Veronica, I'm good, thank you. Good morning. Yeah. So this is the most acute, or what we call severe, of the phase. Okay, when the actual migraine pain happening, this is on this phase we call attack phase. In some people, this can overlap or occur during an oral. Like what I mean is, in some people, it's not very clear of first stage. You get craving, depression, and then move up to oral, and then third you get headache. Some you just get straight away up with oral, like speech issues, tingling, numbness in the hands, and the version's not good. With migraine, straight away they overlap together. Okay, this is, but some it's pretty clear what different stage. Okay, this is what migraine is. Right? Not everyone is different, but you can tell that there's 4 phases. So attack phase symptom can last anywhere from hours to days. You know, how many days? It can come to, I've seen patients up to 1 week or even 2 weeks. Even 2 weeks. How miserable is that? So one is just, some of them just 24 hours. You know, 24 hours up to 72 hours. I've seen people up to a week and 2 weeks. Yeah. But not like they get constant headache, you know, constant, but it get worse and it calm down. It get worse, it calm down. It's not like worse for 24 hours. No, a week. Not like this. They got worse, and they have worse. It slow down and go worse again. Something like that. Right. So symptoms of migraine can vary from person to person. So some symptoms that it can be like increased sensitivity to light and sound. Yeah, light and sound is that increase that you can't. Most people experience a migraine. They have to be in a dark room. They can't go out. They can't turn on the light because it's too bright for them. And most people, when they have migraine, very sensitive to sound, and they have to ask people to quiet down. And I have patients that come to a clinic, and I have music in my clinic, and I have to turn it off for her because it's too much. That noise causing migraine. It got worse and worse and worse. So even with the acupuncture, while the acupuncture, she just couldn't. She keep getting noise and irritate her mind from the music. So I had to literally turn it off. This is how migraine is. So if you treat a migraine patient, if you're a practitioner, you know, you have to ask the patient if you have music. It doesn't matter what music it's quite suiting in the relaxing the music that you know in our clinic, but it's just not suit this patient. We have to turn it off, you know. And nausea. So nausea or vomiting. So nausea or vomiting. So people do get vomiting, you know. And we're going to talk about how many percent of people get vomiting. About 50% of them, you know, suffer from migraine, they get nausea and vomiting. And some people get dizziness when it's on attack phase. They get dizziness or they're feeling fade, water pass down, like just, you know, collapse. And now the actual headaches, actually, where can it happen? We talked about that yesterday too, when we talk about what is migraine. So migraine in Chinese called 偏头痛, which is one side headache. So the headache can be the forehead, the whole head. It can be just stay in the forehead, or one side, or on the top. You know, this side or that side, or on the back. You know, this is the migraine headache. It can be varies. So how could you tell? Some people just every time it happened the whole head and it turned to one side. It turns to just one side in here. Always stay in here and never change. But some just on the back. Always stay in the back and never change. Okay. So after the attack phase, a person will often experience what we call post-drum phase. Right? We have what? Pre-drum phase, oral, attack phase, and post-drum phase. So during this phase, and usually is the emotional change, like the feeling, the mood, you know, and these can be a range of feeling extremely happy. Why extremely happy? Because you just get rid of your migraine, so you're so happy about it. But the other not. You know, it can be opposite, totally opposite. they feel so tired and so sad, you know, and they feel fatigued, very, very fatigued. So it's totally opposite, because they just fight with migraine and they feel very sad, they still get migraine. And it's emotional issues, you know, in the last phase. But in the last phase, it can be still a bit of dull headache. It's not, they know all the light, noise, no nausea, that's all clear. But just a bit of dull headache, it's a bit achy on the head, right? That can be another, that is what we call about post-REM phase. So we need to understand this. This is how migraine is, you know. So if your family member that suffer from migraine, or you suffer from migraine, you're very clear what I'm talking about, right? I'm sorry, I don't suffer from migraine, so but my patient suffer from migraine, and we share this and they share with me, and so I know a bit of migraine. So as I said yesterday, and I hardly get headache and migraine. The only one time that I get headache that I can remember in my memory is when I from Malaysia to New Zealand on the flight, and the flight started, and I get headaches. It's like explore, you know, want to explore, and for about 5 minutes, and then I do the acupressure point, and eventually stop it headache. And I wouldn't say it's migraine because I don't have any other sign. It's just headache, you know, and way off in 5 minutes. Okay, now to be honest, the length and the intensity of these 4 phases, it can happen to different degrees and in different people, right? And sometimes a phase skip, you know, you don't actually go through all the phases 4. It can overlap together, or skip one of the others, or it just straight away go to the attack phases without any pre-drawn phase or aura, or aura and aura and more often the aura and attack phases together. What aura? Aura is speech issues, sensitive in the eyes, the vision issues, you know, and tingling, numbness, sensation issues, and that with the migraine together, the headache, vomiting, you know. This is what it is. Okay. Now let's talk about what sort of migraine pain. If this headache, so what sort of migraine is this? We need to understand this. Patient will say that it's actually throbbing, you know, throbbing, boop, 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 this kind of thing, and pulsating, like it's just like your pulse, you know, just like your heart beating, that kind of feeling, like, oh, it's the artery that actually on the head that you can hear, and the pain is that painful, something like that, or throbbing, boom, boom, something like that, and pounding, something, someone is hitting your head, dong, dong, something like that. It can be this, you know, or debilitating. It get you very weak, you know. It give you very weak sensation, like you get a headache and you feel very weak. Okay, it can also feel like a severe dull ache, or steady. The pain is quite steady. It doesn't go up and down. It's just achy all the time, and down over there, steady all the time. It doesn't change the intensity. It doesn't change the frequency. You know, this is how I describe it. Okay. The pain may start out as amount, but without treatment, it normally become getting worse, become moderate to severe. Okay, this is what migraine. Okay, and that is often happen. Like it started with just a little bit pain in the head, and progressively getting worse. Okay, migraine pain most common affect the forehead area, but it usually on one side of the head, but it can happen on both sides or shift from one side to the other side. Usually from here, okay, but a lot of people feel it in here too. Okay, it usually can be in here too. So here or here, it can shift to one side or the other. As I said before, it can be from both sides. Okay. How long does migraine headache last? I mentioned it before. It can be 4 hours. It can be just 40, up to 24 hours, 62 hours, up to a week. It can up to 2 weeks. Right. So often migraine patients, they have with neck problem, neck stiffness, or with neck pain as well. But the main pain is actually on the head. So they only tell you the head, but you need to ask, do you have neck problem? Can you do your neck? Some they say no, but most people have, yeah, my neck is stiff. My main pain is the headache that actually drag me down. Okay, they will tell you that. Okay, let's talk about migraine nausea. What's the nausea of the migraine? So half of migraine, not everyone get nausea with migraine, but more than half actually of people who suffer from migraine, they have nausea as a symptom. And not necessarily that those nausea patients get vomit, but when they get vomit, that's horrible. Why is that? Because I've seen patients that they know that they're gonna get migraine. They get the pre-drums phase. When they get pre-drums phase, they know they take some medication. Actually, some of them, they actually can stop the migraine happen. It does, which is good, right? They can function properly, right? They can function properly, and they can actually stop it if they take it immediately. Take the medication immediately. The doctor prescribes them. They carry it with them every day, because they just want to prevent it. And when this happens, and they know it's coming, and some people want to control it by mind, or control it to avoid it, to avoid take the medication, and they start to get bad and bad. Then when you lose the chance, what we call the golden period. If you miss the golden period, you take the medication, it doesn't help. This is what my patient told me. They have to take it as soon as they feel it, they take the medication, and it will stop it progressing to get worse, to turn to the migraine, the real migraine. If they didn't take action right now, they wait for go away, and as soon as they get migraine, a little bit come out, and they start to take the medication, it doesn't work. So they work it out themselves, and as I said, I don't have the experience. This is all my patients share with me, and I'm here to share with you, right? So patient, they feel, as soon as they feel it, they have to take the medication, and they know that it works. They know that it can stop it, or it can help to reduce the intensity, and it's worth it for them to take it, and they decided to take it. Okay. Vomiting is hard for migraine patients. Why is that? Because if they end up vomiting and they take the medication and they vomit, and they can see the medication actually throw out the medication, it can't actually dissolve in the stomach and absorbs, so it doesn't help. And some actually prevent them to eat properly. They eat less, and they can't have a good appetite, and they turn to low appetite even if they can't eat anything, because as soon as they eat, they vomit. Okay, now let's talk about treating nausea. So nausea is, doctor will give you anti-nausea, but what we can do as an acupuncturist, we show patient to do acupressure. Which acupressure is good for nausea? This is pericardium 6. Yeah, I have to think about it. The name of it, pericardium 6. Okay, my pericardium 6 is very different with others. So most people, what we do pericardium 6 is 3 finger below here, right? 3 finger below here. Then on this level, right, there is pericardium level. Then between those two tendons, that's how we normally do that. But it's too difficult. Hi Dimitri, nice to meet you. Thank you for saying hi. And please tag your friends or family who suffer from migraine into this post and this video, and please help me to share this video as well onto your Facebook page. So this is the 3. Okay, if you needle, if you're a practitioner, you're needling this. This is how you needle it. Okay, I say this is 9宫内关, which is 9 宫 spleen 6, and it's very useful for chest pain, nausea, vomiting. If you just go to the pericardium 6, it may not work for you. It may not work for you. Okay. Why is that? Let me see. Let me show you. Okay. So over here, 3 finger around, right? Pericardium 6. That's in the middle between the 2 tendons, right? That's how we normally do that. So when I turn to here, it actually. Can you see it here? Yeah, because I have to show you on two different devices. Okay, over here. Okay, let's try to draw it. Okay, there's one line. Okay, so you use your fingers to press it between the tendons. This is a between tendon. That's one point, and press it over here. That's another point over here. That's another point. 1, 2, 3. So in one level, there's 2 points. The first point is in the middle. The other 2 points, one in the thumb side, which is on your closer to your lung meridian, and the other one is closer to your heart meridian. Okay, next to the tendons. What are the others? 6 points. So there's one level. Go up 1 finger. The second level. Again, on the second level, 1, 2, 3. Between the tendon, and one out of the tendon on the thumb side, the other one on the other side of the other side of the tendon, which is on the little finger side. So go down 1 level as well. So 9 point. That's the same. Right. So when all this, how to get to the right point? Like this is good for morning sickness as well. Any chest pain, morning sickness, any nausea, migraine with nausea, vomiting, this is gonna work for you, and it works better with just pericardium 6. I test it out. You know, my patient with morning sickness, they like to bite the bands, and they put it on. And some they say it's not working. I say, why it's not working? And when I go and press it, they are putting the point wrong. Because some point, sensitive point, actually off between the tendons. You can do it yourself, you know. You can press it like, in my case, this is the middle. I don't feel anything. Not this one. Not this one. Not this one. A little bit up there. Let me try it. Okay, my one is actually more in here. So this is the middle point. Down 1 level, closer to my lung meridian. This is my most sensitive one. And the second sensitive one is actually not on the pericardium 6 itself. It's 1 level up the pericardium. And that one on the middle. And I can feel it tingling in here, and it's so sensitive, tender, very tender. So here and here, that's my 2 point. And I ask my patient to check all the points and get the most sensitive one to work on first. If that helps, and you still have this nausea or chest pain, and then you keep going to work on the next one. As an acupuncturist, that's easy too. That's how I work it out. I put one needle in, and a patient feel better, but they can still feel it, the sensation of nausea, and I go around and poke it, find those 9 points, and when I get to the next sensitive one, I put one more needle. You know, you may put 9. I never put 9 needle. I don't know why, because I couldn't find people that have patients that have 9 points of them are all sensitive. You know, I can put up to, I think, 4 or 5 needles sometimes. Just 4 or 5 needles in, and I don't even do the twitching technique. No, just needle in and small needle in there, and ask them, how do you feel right now? Good. So 1 needle and 4 or 5 needle are very different, but get to the point. In this case, you need to get to the point. If you miss the point, it doesn't help, right? Can we use 1 needle cover the 3 vertical point each time? That is in 3 needle for total 9 points. Veronica, good question. Can you use 1 needle for multiple points? Yes, you can, but I choose not to do this because this is a very sensitive point in here. I would say, why not doing this? Okay, because if you're doing on the middle point, pericardium 6, okay, you take it out and you're gonna go the other, up and down. Most likely you hurt the nerve and they get shocked. Not very good sensation. But some practitioners, they put 1 needle and twitch it and get the sensation, and that's on your choice. If you want to do that, and that's okay. And when you put needle in, you want to go to that side and that side, you can't because the tendons, you know, we know that. But on those two, you can try. But the other reason I don't do this with 1 needle and go side by side, cover the other, okay. The reason I do this, I use small needles. 15 mm. You know, I don't have to put long needle in here. Just small needle and take it in, because what happened is, and over here, and when patient move fingers or hand, if you needle, you know, because I used to put more needle in here and patient move, oh, it's so painful. And literally it moved the skin and muscle and the tendon here, and it moved the needle, and it's so painful for them. Even though sometimes I just put 1 pericardium 6, and I put in there, and patient move and they feel pain. So I choose not to use 1 needle and cover a long area, like 1 needle and go through like this, because I assume it'll make patient uncomfortable. That's just my choice. But yeah, you can try it. Just use 1 or 2 needle and cover the whole area. If you can do that, that's no wrong or right. Okay, it's just how you practice, right? Yeah. Okay. Something like that. I think this is the last part that I want to share with you is this. Okay, I share with a lot of people, and they help a lot of people. And I share with the patient, and it always work. It always work for nausea and chest pain. And when I call it 9 con 內關, 9con 內關, okay, and 9 con pericardium 6, 9 point of it, not just 1 point. You need to get to the point in this case, okay? This is very, very important, right? So that's it for today. We cover the symptoms of migraine. What are the symptoms of migraine? We cover everything of the symptom of migraine. Now, tomorrow, we're gonna talk about what causes migraine. What causes migraine, and then the day after we're gonna talk about what are the treatments for migraine. Works for reflux, yes, definitely. This works for reflux. Okay, for reflux, it works for a reflux. Okay. What if the reflux sensation in here? Again, the nausea. What if the nausea sensation in here? That's all gone. So the nausea sensation and reflux sensation, it can be in here. It can be in chest. It can be in here. and it can be quite widespread over here. It can be just in the middle. It can be those, right? So how do you go to it? Normally over here, it can show out here and chest, but it doesn't really help the neck sensation. And the nausea stay, the sensation actually stay in here. Okay, which means you have to go up to here to put some needle. That is treating here. Okay, and I actually my often used area, I may choose here. I may, after this, I may not choosing here anymore. Where do I go? I actually go to here. Like how you treat neck pain on for using the scalp acupuncture. So actually using here to treat here more often and the work. And I tell you what, at this point over here, like 17, that area, it treat patient that they feel something stuck on their throat. In Chinese we call 没和气. I don't know about in English. 没和气. Like there's something stuck in there and they want to spit it out, they can't. And there's no mucus. They thought it's mucus. Can't. And they want to swallow it, they can't. Something in here. And I treated successfully with those points over here. And of course, in China, according to Chinese medicine, those people are more stressed. People are worried a lot, and they anxiety with emotional. Okay, and guess what? This point, I tried many times with patients here. They have something in here, and needle it disappears straight away. I said, well, try to feel it. They can't feel anything. Well, try to swallow it. Can't feel anything. That's it. But it doesn't last. The bad news, it doesn't last. Why did I say that? It can last for 24 hours or 1 or 2 days. It always come back. It always come back. But when it come back, it may be, the intensity may be the same. It may be changed. It may got better. They feel, oh, it's actually better. And oh, plum seed thought. Thank you. Now, I learned something. Thank you for Karuna. Thank you. Yeah, I learn things every day. That's great. Plum seed thought. Okay. Plum seed thought. Yeah. 梅和气. Yeah. 梅和气. Yeah. 梅和 is plum seed, right? Yeah. I never thought about that. Plum seed thought. Okay. Yeah. And this is the symptom of that. And I've treated a couple of people that they actually get rid of those things. And the main needles in here, because I treat the whole body. I balance the pose, and I do balance method acupuncture for global balance, and I do all this. And you know, when you treat this, you're treating the emotion. And I find that when you treat all the emotion according to, you choose the pattern to treat the emotion, they can still feel it. They still feel the sensation in here. It doesn't really actually help. But when I put needle in here and get rid of it, and based on treating the entire organs, then it worked well. It lasts. You know, it lasts. So all the patients that actually treat the organs, and based on that, and ask them whether they have any decrease of this, and they say no. But once I ate on this, it straight away remove this, then it's very stable. And after few treatment, and actually get rid of this. You know, this is my experience. In Japan, they drink plum liquid for cough. Thank you. Ah, did they use plum liquid for plum seed thought as well? Do they? I never heard about that. But for coughing, only for coughing, but not for plum seed thought, right? The symptom of that. I never heard about that. Good to know. All right. Yeah, it's alcohol. I know. Yeah, it's alcohol. Yeah, Meijio, right? I think I've tried Meijio in China, but I didn't know that it can treat coughing. Yeah, I didn't know that. Yeah, good to know. Good to know. If anyone texts me and say, "Well, do you know how to treat cough?" I say, "Well, do you have plum liquid alcohol? If you have, just try some something like that." No, I don't know. But yeah, thank you very much and being here with me. Please tag your friends into this video and let them know that you're watching this video and we're talking about migraine, and this may help them for with they suffer from migraine and with nausea, and they might want to know this, and if they watch this video and they know how to deal with it, okay? Because if you can stop the dose point, not necessarily stop the migraine, it actually will decrease, or it may stop the vomiting and nausea, and that actually anything that can help them to decrease the symptom, and it's worth it to do, okay? But migraine, vomiting and nausea is associated with migraine, so you really want to treat things as the migraine, not just focus on vomiting and nausea, okay? But vomiting and nausea is a symptom that actually prevent and get better, make things worse, and you want to treat that too as an acupuncturist, okay? That's it for today, and tomorrow we're going to cover what causes migraine. I'll see you tomorrow morning. Thank you very much. See you. Bye bye.